Mask up.
Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
So you've heard about the confusion about the mask guidelines. Was it based on some statistics, some research, or was it kind of this arbitrary, yeah, it kind of feels right?
It's definitely not arbitrary, and it definitely didn't feel right. It was kind of caught everybody by surprise, including myself, that it came this fast. But it's based on two very large studies of people who've been vaccinated, an Israeli study and a study in healthcare workers. And they looked at them, and they're either not getting infected, and if they do get infected, they're having very few symptoms, if any, and they're not transmitting it to any kind of reasonable extent. So it's basically, you're vaccinated just like you're vaccinated for anything else. You're vaccinated for measles, you run into somebody with measles, you don't get measles, right? It's the same kind of concept. And I think what just caught everybody off guard was just kind of how abrupt it came out. It was just April 27th that they said it was okay to take your mask off outside. And here we are, you know, in the first part of May, or, you know, May 14th, whatever it was, that she made that announcement. I mean, it's great. This is what's supposed to happen. Now we just have to implement the policy.
Well, that's what I was going to say. People, you know, so people walk into the Jewel and they're thinking, all right, CDC says no masks, but you still, is it just going to take the state a while to catch up? When do you see all of these businesses and everything else will open up and say no more masks?
Well, the feds, you know, they're just saying, this is the science, this is what you can do. And it's really determined by the states. The state really has all the power about public health and how the population behaves and what they have to do and what they can't do. So, you know, it really depends on state by state what's going to happen. It's the honor system. Nobody's going to be checking anybody. I mean, obviously, it's safer if fully vaccinated people are together and that unvaccinated people use the mask. The biggest risk, though, is if the unvaccinated people don't wear the mask, they are the ones at the most risk.
All right, let's get to viewer questions. The number of COVID-related deaths in Illinois continues to be about 25 to 45 per day, even though the positivity rate has gone down below 2.5%. Why are we relaxing restrictions when the number of deaths has still not gone down? Isn't it true that too many people are still not vaccinated?
This is a very astute observation, and it's a very stubborn metric that's really not going down. In the United States, in total, it's about 600 deaths per day. Illinois seems to be stuck in this 15 to 35 deaths per day. That's like way too many. Now, why is that metric kind of stuck there? That is obviously the last thing that happens to a person. You know, we're looking at, you know, new infections, symptomatic infections that get so sick you end up in the hospital. That's like 10 or 15% of people that are infected. Symptomatic infections, really sick in the hospital, that go to the ICU, that get ventilated, and of the ventilated ones, you know, how many people pass away. So, you know, have to go all the way down that line. And we know how to treat the people in the hospitals, you know, much better now, so they live longer. So that death rate is still kind of stuck out there. So I think it's a matter of time before you see that go down. When you see the death rate go down, things have really turned the corner.
All right, next question. I used to feel comfortable bringing my small kids for a quick Target run, knowing everyone was masked. Now there's potential for unmasked, unvaccinated adults to be in those stores. Is it safe?
Well, it is safe. Your kids should be wearing a mask. Unvaccinated people should be wearing a mask. So, you know, we have to account on that. Also, the thing with kids, you know, their disease is usually much milder. So if they did happen to get it, you know, they generally don't get sick, and the parents are vaccinated, so they're not going to get it from the kids. So the cycle kind of stops right there. It's not good that they get infected, though, and they should wear a mask. Anybody unvaccinated should wear a mask. That includes children.
Next question. I'm supposed to go to a wedding out of state in July with 200 attendees. I'm confident most, if not all, will not be masking, and I'm still leery about being in close contact with those who aren't vaccinated. I am fully vaccinated. Should I go?
Yeah, it's a personal decision, but yeah, you should go. You're fully vaccinated. You have a lot of things going for you right now. I hope that the host, at the wedding host, has told all the guests that, that these guidelines are in place. In other words, unvaccinated people should be wearing a mask. If they don't, you're still protected. You're protected. You may get COVID, but you're going to have a very mild case. You may not even know you have it. That's really what the vaccine does. So, you don't want that to happen, but it's not going to be a severe thing. The risk is for the unvaccinated people.
All right, Dr. Murphy, thanks again. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good day.
All right, have a great day.
Thanks,
Thanks.
Doctor.
Hey, Paul.
Good morning. We're looking at